So in this presentation, I aim to do a very brief introduction to a kind of a recent ICAM publication. Some of you have seen me mention this in the workshop a couple of days ago, and what its implementation has been teaching us about the realities of monitoring and evaluation in DPM. So at our last international conference in Istanbul in 2015, we launched this guidance document, this big fat one, Are We Making a Difference? A Guide to Monitoring and Evaluating DPM Interventions. Now, the impetus to write this guide came from a number of places, and that was not least the discussions that the ICAM coalition members had when we were pulling together ideas for the first guide on how to do DPM. So the ICAM members described how their different approaches to DPM had worked. They talked about the best way to successfully manage dogs, but without any shared definition of what the term worked or successfully actually meant, or indeed any agreed way of measuring objectively what worked best. But both ICAM members, partner organisations and others in the field were busy innovating ways of collecting data that could do just that. So the aim of this guidance document was not to set a gold standard for monitoring and evaluation, but to collect the best yet experiences into this how-to guide, with the goal of helping everyone in DPM to track progress, learn and get better at managing dogs humanely. So the guidance was written to be practical for field implementation, assuming a resource-limited scenario. And it was designed to be flexible, so it gives you a selection of options from which you pick what suits your project and your dogs and communities best. So the guide assumes you're trying to make a difference in one or more of these 8 commonly stated impacts. And for each of these impacts, it gives you a list of potential indicators to choose from. And the indicators are those measurable signs of impacts. They were what you'd see or what you would hear if any of these impacts was actually coming to be. So this is an example from Impact 1, which is to improve dog welfare. And you can see 8 potential indicators listed here to choose from. Now, some of them are described as recommended indicators because we saw them working well in DPM interventions, and others are suggested indicators. And they've been developed from examples of indicators used in other fields, such as farm animal welfare or human health or development. And then for each of these indicators, you're also given suggestions for one or more methods of measurement. So those are the ways in which you collect data relating to those indicators. So we've been testing this guide within a few selected projects, part funded by our ICAM members, and also listening to the experience of others, many of which are in this room. So what have we learned? Well, firstly, we have to note that many of the impacts we are aiming to have are long-term in nature. So think about reductions to dog density or changes and improvements in how people care for those dogs. That may take a few years to become strongly apparent and further time to reach a steady state. So we are looking into the question of whether these are the right indicators. Are they accurately measuring a change in the desired impacts? And are they sensitive enough to measure small changes in impact? But actually a lot of what we've learned so far is about the ease of implementing the methods of measurement, and not just implementing these at baseline, but repeating them consistently over time. So can these indicators be measured at all? Are they accessible? And are the methods repeatable between observers and over time? So far, the number of roaming dogs per kilometre of streets surveyed appears to be working well as an indicator of whether a DPM intervention is impacting roaming dog density. So where we've seen a reduction in this indicator, that does seem to be backed up by citizens' perceptions of there being fewer dogs on the streets. However, I did want to mention one location where I experienced a general public perception of a significant reduction in dog density. So the people that we interviewed thought there'd been a decrease in roaming dogs by an average of 60% over the last 5 years. But that was not supported by the street surveys that we were doing over the same time period. They showed an increase and then a decrease in dog numbers straight back to baseline over the same 5-year period. So what appeared to have happened was that there was a change in dog behaviour and welfare that had made the dogs less prominent to the public. So over 80% of the roaming dogs had been sterilised in this 5-year period. And as a result, there were fewer females in heat. And so there were fewer packs of males lecking around those females and fighting. And because so few puppies were born in the street, that disturbing sight of seeing a suffering and dying puppy was quite a rarity. So the perception wasn't wrong, but it was driven by more than just numbers. And so it is worth simultaneously capturing data, not just on density, but also the percentage of lactating females as a measure of breeding activity, and visible welfare. And we tend to use body condition score and skin condition as crude but easily accessible measures of dog welfare in roaming dogs. Because this isn't just about numbers, but also about their behaviour and welfare. And the street survey method that we recommend in the guide, which can deliver data on all of those indicators, appears to be efficient and simple to implement. So where we've supported its introduction, it is usually consistently repeated. So the other method of measurement that's performing well is using secondary sources of data to measure indicators. And that may well be a cost-effective option for DPM implementers because it's actually commonly someone else who's doing the measuring. So this does usually require a good working relationship with stakeholders who are responsible for this data. So that might be hospitals and clinics who have data on the number of dog bites, or specific departments within municipalities that record the number and nature of complaints, including those related to dogs. And Dr. Sanjay Singh is going to be sharing just one example of successfully using reported dog bites as a measure of DPM impact in Jaipur in India just this afternoon at the conference. And we also have a case study from HSI on our ICAM website that describes the positive impact of community engagement project on dog-related complaints to municipalities in 2 other Indian cities. So it does appear to be working. Now, we've also been able to identify those indicators where our methods of measurement are currently lacking, and we really need to invest in developing new ways of capturing relevant data. So I've already talked today about the public perception of dog numbers, but we can also ask people how they feel about dogs. Do they fear them? Do they find them a nuisance? And also about their opinions on DPM interventions happening in their community. So in our sort of democratic and increasingly connected communities, not least through social media, this is becoming ever more visible. We also want to know what people are doing, how they behave, whether that be negative behaviours, in particular abandonment of dogs, or positive behaviours, such as taking responsibility for consistent good care of dogs. Now, traditionally, we've used household questionnaires to access data relating to these indicators, but in our experience, these are time-consuming and therefore expensive, and so they're rarely repeated. And so they don't really work for monitoring and evaluation in most resource-limited contexts. So we do need to look at more cost-effective ways of accessing the public, and I suspect that online will be the way to go, including social media. And questionnaires do also tend to give quite a shallow level of information about people's perceptions and feelings, and so I see focus groups and participatory research as probably a potentially more fruitful area for our efforts, and that's where we're spending a bit of our time at the moment. We can also now identify some of the challenges to monitoring and evaluation happening at all. So limited resources is the classic barrier, not just funding, but also the time to pause DPM actions in order to run some data collection methods. And this can be a particularly significant barrier when monitoring and evaluation is first embarked upon. People need time to build their capacity and knowledge in data collection analysis. We also find that many DPM implementers are activity focused, sometimes because their project was created in a hurry in response to a crisis, such as a politician suddenly calling for a dog cull or a rabies outbreak or both. So they didn't have the luxury of time to create a clear project purpose or vision, and hence they haven't defined their impacts, let alone selected suitable indicators. They just needed to do something to show humane DPM activity rather than achieve a change in a targeted impact. And finally, I've met some DPM implementers that have diligently collected monitoring data for years but have never had the opportunity to actually analyse and learn from this data. So the space for evaluation just hasn't really been made. So all of these challenges are surmountable, but they do go some way to explaining why monitoring and evaluation is not consistent or even common in our DPM field. One challenge to monitoring and evaluation that ICAM is also working on currently is this issue of simple and accessible tools for monitoring. In particular, we were interested in making surveys of roaming dogs easier to perform and therefore more widespread. So we noted that people wanted control and to own their own data, and they desired flexibility in tools that allowed them to measure what they see as relevant for their community. and that some very basic analysis capacity might help to get that data used and part of regular evaluation and learning events. So we are currently developing a survey app with this web-based interface. The app will provide both a navigation function and also a way of recording observations when surveying, whether that be on a route or within an area. The web-based element will allow users to create their own project space where their data is accessible to them and kept backed up and secure. It will also have the flexibility for users to design their own survey layout, so stating those variables that they want to record when surveying their dogs or any other species, so they can pull out a standard layout from a library of templates. So it will have a level of flexibility within it, and it will include some basic analysis. So you can visualize your data on graphs as it is collected, and we're aiming for release in 2020. So that just leaves me to encourage you to take a look at this guide. You can download it from our ICAM website. That's not the first time I've said that, is it? There we go. But also do take a look at the tools page of our website, and that's where you find the impact assessment tool. This is quite a thick book, sorry. It had to work for 8 different impacts, so it is a necessarily long guide. But what that tool does is it asks you a series of questions about your intervention, about your dogs, and then it returns just those indicators and methods of measurement that seem most suitable to you. So you get a much skinnier guide that's tailored just for you, so do give it a try. I also want to make a plea for you to share your monitoring and evaluation experiences and innovations so we can include them in future editions. This is all about collating experience of the field, not just what ICAM does. So, and of course, thank you for listening.